Welcome everyone. We are now on day 2 of our summer boot camp workouts where I'll be going over the healthcare provider billing procedures. Today we'll be moving on to the jungle gym, the monkey bars, where you'll be jumping around, finding all of the information necessary to get your medical bills ready to be submitted to the insurance company and making sure everything is correct on your end so that you can have a successful medical bill submission. So I hope you're rested, you have your shoes on and laces tied so you can keep up with me in this workout. In this workout session, you're going to learn how to complete and submit medical bills to the insurance carrier and the deadlines and steps for both healthcare providers and insurance carriers. While we're warming up for our workout, I do have to remind you of our disclaimer. My presentation today is for your education. However, system participants are ultimately responsible for knowing and complying with the statutes and rules, including the Texas Insurance Code, the Texas Labor Code, and the Texas Administrative Code, which will direct the resolution of any disputes or complaints. This is super important, and it's why we want you to know exactly where to find this information and why we have provided you with the PDF interactive resources document, which is a roadmap to get to these rules and statutes and to all of other information and resources that's on our website. However, if you're still having trouble finding the information, you can always call Comp Connection and we'll assist you by navigating you to the information that you need. All right, let's get this workout going while you're on the move by going over the basics of billing a workers' compensation medical bill. Now that you have correctly identified an injured employee as workers' comp, you've verified the correct employer's coverage information, and you have the carrier information like where you need to send the bill. Here's an overview of what we'll be learning today. We'll be going over the billing rules found in the Texas Administrative Code and some of the statutes that are found in the Texas Labor Code. Completing a medical bill on CMS 1500 instructions. Some of you may refer to this form as a HCFA. This is used by doctors, physical therapists, and individual healthcare providers. Once your bill is complete, how do you submit the bill? What medical record documentation are you required to send with the bill? And this would be for non-network claims. We'll talk about what the insurance carrier does with the bill once received and what you will need to do to appeal the carrier's response or EOB, also known as a request for reconsideration. And we'll go over other resources. Okay, let's get into this workout. In workers' compensation, it's good to know the rules of the game, and in this case, the billing rules. This is why we recommend initiating this process by familiarizing yourself with the rules which contain the billing guidelines for submitting workers' compensation claims. This is a good exercise for any new workers' compensation medical staff and for all healthcare providers to warm up for your workout. Remember, you're responsible for knowing the rules and the statutes. And basically, in Chapter 133, you're going to find all of the steps to bill and the timelines. Chapter 134 is where most of the reimbursement rules are. And Chapter 133, this is going to be your water bottle for this workout. So pick up your water bottles and let's hydrate your mind with the information in these sections. After intake or registration and any necessary pre-authorization has been completed and treatment is provided, you'll be completing a medical bill, and Chapter 133 is going to guide you through this process. If you look closer at what subchapters are included in Chapter 133, Subchapter A has general rules for billing and processing. Subchapter B for billing. It has all of the health provider steps for submitting a medical bill. C is what the carrier does once they receive your bill. D is for dispute of medical bills, and subchapter G, if you're billing electronically, this is where you will find all the e-bill standards. Chapter 133, applicability. This slide is to tell you that all the billing rules in Chapter 133 apply to both non-network and network claims. However, with network claims, there are a few exceptions, meaning these exceptions do not apply to the network claims. The exceptions are the medical fee and medical necessity and dispute resolution rules in subchapter D, section 133.210, medical documentation requirements do not apply to network claims, as the healthcare networks may establish their own documentation requirements, and section 133.240, subsection B, which states that the insurance carrier cannot deny reimbursement based on medical necessity when the healthcare services provided have been pre-authorized or voluntarily certified. And also subsection I of Rule 133.240, which is about reconsideration. For non-network claims, a healthcare provider must request reconsideration from the insurance carrier prior to requesting dispute resolution for a denied bill. This does not apply to network claims because the networks have different appeal processes. So be sure to check with the network for documentation, reconsideration, and dispute resolution requirements. Medical bill formats. Your medical bill will either be submitted by paper or electronically. Rule 133.10 will inform you which paper bill formats are used and which fields are required, conditionally required, and not required. This includes the CMS 1500 or HCFA, the UB04, the 2006 ADA dental claim form, and the DWC 66 pharmacy bill formats. For those of you billing electronic, Rule 133.500 and related rules address those requirements and formats. Now we'll go over medical bill charges and coding. A healthcare provider must charge their usual and customary charges, meaning you would charge the same amount for a non-workers' compensation patient for the same service, and you will generally be using the most current CPT, HCPCS, and ICD-10 billing codes for your billing. There's one slight exception, case management codes. And I'm not going to get into that today because we'll be going over case management billing in our healthcare provider professional reimbursement webinar on Thursday, August the 15th. So please register if you haven't done so already, so you don't miss this information. Medical bill submission. Who can submit a medical bill? Well, you need to know that if your provider is a licensed healthcare practitioner, they must bill under their own license. According to Rule 133.20, the medical bill must be filed under the licensed healthcare provider unless it meets these exceptions. The provisions found in 133.20 is one that conflicts with Medicare's Incident to billing, where a licensed healthcare provider bills under another licensed healthcare provider's license number. This is not allowed in the Texas Workers' Compensation System due to this rule. For example, I received a call from a healthcare provider 2 days ago because the insurance carrier denied their bill where the physical therapy assistant or PTA was the rendering provider, and the bill was submitted under the physical therapist's name and license. And she said they've always billed it this way because they're required to, and because Medicare says that they can. So I informed her that when there's a conflict in DWC rules and statutes and Medicare payment policies, our rules and statutes, and in this case, Rule 133.20, takes precedence. Therefore, because the PTA is licensed, they must submit their own bill. So don't let this happen to you. Make sure you're billing under the licensed healthcare provider that rendered the services or treatment. And if you must make changes to the bill, this new bill must be submitted within 95 days from the date of service. Let's go into some of the details on the CMS 1500 or HCFA based on our rule and some of the issues that come up from your calls. Required billing. The required billing rule can be found in Rule 133.10. This section outlines which paper form should be used for the different types of billing. Not only does it include instructions for the CMS 1500, which is used for professional billing, but also dental claim forms, pharmacy, and the UBO for facilities, or institutional billing. Every field that is required or conditionally required will be will be listed with the related field in parentheses next to it. This means that if a field is not listed in Rule 133.10, it's not required, and a bill should not be returned by the insurance carrier. Rule 133.2 defines a complete medical bill as one that follows either 133.10 for paper billing or 133.500 if you're billing electronically. If you've entered all the required fields and or the conditional fields with data, the bill should be considered complete and should not be returned by the carrier. Even if more than what is required is listed, a bill shall not be returned as incomplete. If data or information is populated in the field that is required or conditionally required, even if the carrier believes the information is incorrect, it's still a complete bill. So, for example, when the healthcare provider enters the incorrect address for the employer in field 7 of a CMS 1500, that would still be considered a complete bill and should not be returned. If you believe that a carrier is returning a bill that is complete, please go to Rule 133.10 to check for that exact information that is missing. And if you still feel like they are wrong, you may file a complaint, especially if it's a pattern of practice by the carrier. And you can find the administrative violations by an insurance carrier in Texas Labor Code section 415.002, which you can include with your complaint because it's helpful. So you'll want to do that. And you also want to be sure to copy the insurance carrier when filing a complaint with the division. And Amy's going to post a link to that section. And remember that the 95-day clock to submit a bill is still ticking until you get the bill accurately completed. And in turn, if you have submitted a complete bill, you have told your time. If a bill is returned correctly and you need to correct it, your 95-day clock is still ticking. An EOB issued usually means you've told your time. This image is of the CMS 1500 HCFA version 212, which is the correct version that a healthcare provider is required to use per Rule 133.10. It's used for professional billing and ambulatory surgical center or ASC billing. Required billing forms and formats. As I mentioned earlier, if a field is required or conditionally or situationally required, the field must be populated with something. And hopefully you have the correct information that has been gathered during intake. In this slide, you can see that for workers' compensation, the employer where the injured employee was working at the time of the incident is the insured. This employer's insurance carrier is responsible for medically necessary treatment for the compensable injury for the life of the claim, even if the injured employee has changed jobs 5 times and is no longer employed there. They're still responsible. The employer's address is important for insurance coverage verification and for this field number 7. It will help the carrier process the bill and the insurance coverage be verified correctly. And remember that an individual person can have multiple claims or injuries, so it's important for you to list the related employer for that particular injury in this field for this bill. And the word claim in workers' compensation usually means the injury or illness that is work-related. And in the healthcare provider world, sometimes claim means the individual medical bill. So be careful to distinguish between the two. Conditionally required under specific conditions. Note that the insurance carrier must not return a bill that does not have a DWC claim number or when left blank, as the claim number is only required when known, or should not return a bill when the claim is not established. Field 11 is a conditional field. Again, if you receive a denial, go look at the Rule 133.10 and compare it to what you billed and correct it accordingly, and quickly resubmit your bill to the insurance carrier within 95 days from the date of service. This rule was amended last year for designated doctor's exams, and any related bills for referral testing providers. So effective June 1st of last year, 2024, these bills required a designated doctor's assignment number in field 23. It's been a while since I've received any calls in Comp Connection about this change, so I'm assuming everyone's adjusted to the new requirement, which is great. Now let's talk about the healthcare provider state license format. I often receive calls in Comp Connection from healthcare providers whose bills were denied because the healthcare provider state license number is entered incorrectly on the bill. The healthcare provider's license number must be formatted as seen here on by the license type, license number, and jurisdiction code, and you must use the 0B qualifier when entering a provider's license number. So your healthcare providers that do not have a state license number only need to enter the license type and jurisdiction code. And here are just some of the many different license types. Licensed healthcare providers may bill directly, for example, audiologists, if licensed, can bill, and will need to choose the best license type that fits the type of medical services that were provided. You can find the complete list of the license types in Rule 133.10, subsection I. You must select one of the license types in this rule section. If your actual license type initials are not listed in this rule section, you cannot use it as a license type. For example, APRN for an advanced practice registered nurse or NP for nurse practitioner are not listed, so they can't be used in the license format. Another example not on the list of license types is PTA for physical therapy assistant. Remember, you must choose a license type from the list in 133.10 subsection I that most appropriately reflects the type of medical services that were provided to the injured employee. Now let's talk about the deadlines to bill the work comp insurance carrier. You must submit your bill within 95 days from the date of service, and that is outlined not only in the statute 408.027, but also in rule section 133.20. If you change a billing code such as a CPT code, HCP code, or diagnosis code, it could be considered a new bill and must be done within 95 days from the date of service, or you risk a denial for submitting a bill past the 95 days. Corrections to the modifiers and number of units are allowed upon reconsideration. Therefore, the insurance carrier should not consider these corrections as another bill. You can find this language in the adoption preamble of Rule 133.250 in the Texas Register. And if you would like this information and need assistance finding the language, you can call us at Comp Connection, and we can help you navigate to this information on the Texas Register's website. Now that you've completed your medical bill, we'll now talk about how to submit your bill. And this information is also found in Chapter 133 of the Texas Administrative Code. How do you compute the 95 days? Rule 102.3 explains the computation of time and defines day and working day. If you're computing time by days, the first day is excluded and the last day is included. So for example, when submitting your initial bill to the work comp insurance carrier and the date of service is January 1st, 2025, you're going to start counting on January 2nd. That's going to be the first day of the 95 days, and April 6th is the last day, which is the 95th day. If you're counting by months, for example, when you're submitting your bill for reconsideration and the date of service is January 1st, 2025, you'll have 10 months from that date of service to submit the bill, and that period ends on the same numerical day of the 10th month as the day of the month from which you started counting from, making your deadline November 1st, 2025. What if the last day of the period is not a working day? Well, unless the rule says differently, the next working day will be used. A working day is defined as any day, Monday through Friday, other than holidays mentioned here. When you see a rule that just says day rather than a working day, that means calendar day. Exceptions for untimely submission of a medical bill. What if you don't get your bill into the correct work comp carrier within 95 days? Well, the good news is that there are some exceptions to the 95-day filing deadline. Those medical bills that were incorrectly classified as either group accident, health insurance, an HMO, or the wrong workers' compensation insurance carrier, but were filed within 95 days from the date of service can qualify for an exception to get your bill to the correct workers' comp carrier. The big note here is notice that the exceptions do not include billing the patient over 95 days or sending your bills incorrectly to the Division of Workers' Comp. Remember, we're not an insurance company and we do not process or pay bills. Or if you send it to the employer over 95 days. In these instances, you will not qualify for an exception unless the carrier agrees to make an exception on their own. Please document what happened. Say if you were billing an injured employee over 95 days, did the injured employee not give you information on workers' compensation? You should have documented the circumstances and what the injured employee said when they were registering. And on the way out, if you are in urgent care or emergency room. All self-pays need to be paid special attention to so you don't pass 95 days. You may want to set a follow-up date for yourself when you're billing the employer so you don't go over the 95 days and miss the opportunity to bill the workers' comp carrier if the employer does not pay timely. Give yourself some time to get that bill into the insurance carrier timely. Additionally, the statute also allows for an exception when there are catastrophic events like a hurricane that disrupts normal operating process or a pandemic. In these cases, the commissioner will publish a bulletin and will outline the details. Like sometimes for hurricanes, only certain geographical areas meet the exception. And for instance, the commissioner's bulletin B-0010-20 that went out on March 25th, 2020, referenced the coronavirus or COVID-19 workers' compensation issues. And this bulletin allowed for tolling and medical billing deadlines and stated that failure to submit a timely medical bill will be deemed an exception due to a catastrophic event under Labor Code Section 408.0272, subsection B2. You should always pay attention to our bulletins for when the normal billing times resume. So that's why it's important to subscribe to our emails so that you stay up to date on that information. And once again, you can go to your DWC map and go to the topics A to Z and select E for email updates to subscribe. Lastly, even if you're past 95 days, I would suggest that you send the bill into the correct work comp carrier because they may make an exception that the law does not outline. Make sure to have documentation on what happened and that you did all within your power to find out the work comp information upon registration or discharge. New 95-day filing deadline. You'll have a new 95 days once you find out the medical bill is workers' compensation or once you find out the correct information. You need to have documentation that proves your medical bill qualifies for an exception to the timely filing deadline. This is when patient accounting software documentation is important. You need to know who you sent the bill to and why. When did you submit that bill to them? Was it within 95 days from the date of service? The date when you found out it was workers' compensation and who told you that it was workers' compensation and their contact information. We recommend that you refund any money such as copays, deductibles, payments that were taken from the injured employee and quickly get the medical bill into the carrier within 95 days of the date you found out it was workers' compensation. How do you meet an exception? Now, this is information that is not in our rules, but are just suggestions on best practices in order to meet an untimely exception. So as I just mentioned on the previous slide, as soon as you find out the correct work comp information, you have a new 95 days from the date you were notified. Again, documentation is going to be extremely important in order to combat any denials for timely filing from the carrier. So if you're billing another payer and you get an EOB or notice from that carrier or from the injured employee or the representative, or even from the correct carrier stating that they are responsible, you should very quickly send all bills related to that treatment or condition to the workers' compensation carrier and show your documentation that the correct workers' compensation to that correct workers' compensation insurance carrier in order to avoid any questions on deadlines. And showing the date that you were notified by who and how could be included along with a copy of the Texas Labor Code 408.0272. Billing the injured employee. Now we'll talk about pursuing a private claim against the injured employee. If you collected payments from the injured employee, we recommend returning these payments. If you do not return payments made by the made by the injured employee, you request violation or you risk violation of Texas Labor Code 413.042. It is important to document what the patient said upon admission and registration and during intake and what they are saying now. If the injured employee files a complaint that you collected money from them for a workers' comp claim, the division will look at whether 413.042 was violated or not. This is one of the number one reasons a healthcare provider can get into trouble with the division. You can go to the D in the Texas Workers' Compensation topics A to Z for disciplinary actions where healthcare providers have been fined for collecting from the injured employee. So you don't want to be added to this list of violators, so please don't do this. Labor Code 413.042 states that you can bill the injured employee, but only if the division determined the injury is not compensable, which we call final adjudication. So it has to have gone through that final adjudication process and been determined to be not compensable by the division. Or number two, employee selected a doctor that was not permitted to participate in the workers' compensation system, and the doctor did not know of the violation at the time the services were rendered. Injured employees have a network claim or that have a network claim are responsible for selecting healthcare providers that are in the network. And you can read more about this in the Texas Insurance Code, section 1305.451. And also when an injured employee has paid for medication prescribed by a doctor. This is usually when the pharmacist collects the cost difference of a brand name and generic drug. You can find more information about this in Rule 134.504. What if the injured employee wants you to bill their private insurance for a workers' compensation claim? Well, the bottom line is to assess your risk of violation of Texas Labor Code 413.042, because we can't tell you how to run your practice or your medical office. So best practice is just that. Nor can we guarantee an outcome in dispute resolution or in the complaints department. All evidence will be weighed, but you want to do everything you can to find out if it's workers' comp or not. So you may want to create a patient statement asking, is the treatment you're seeking for a work-related injury? Yes or no? Have the patient sign this statement and do this for every registration, no matter if you think it's work-related or not. And if you did not get this in writing at the beginning, get it later. Collect those copays, deductibles, and are set up a payment plan with down payment for self-pay. Because sometimes if they know their responsibility, they may change their mind. And if they do, and you are collecting money or have collected money, they could file a complaint on you for violating 413.042. And so just want to, the message here is to stay on top of what they say and make sure they understand their financial responsibility either way. Let's move on now to billing the employer. Note that this would be the employer where the incident or injury occurred. Rule section 133.20 allows for the healthcare provider to choose to bill a willing employer. So if you have a good relationship with an employer who would like to pay you, that is allowed, but with some conditions. When a healthcare provider elects to bill an employer, you waive certain rights. Those rights waived during the election period are prompt payment, interest for delayed payments, and medical dispute resolution. You can find this information in Rule 133.20. When you elect to bill the employer, you still must submit an informational copy of the insurance. You must submit an informational copy to the insurance carrier, even though some employers do not want you to do this. It is required. You must bill in accordance with the DWC fee guidelines and the Texas Administrative Code section 133.10. Once the healthcare provider chooses to bill the work comp carrier, their election period ends and they do not waive their rights anymore, but they could still miss the filing deadline if they wait too long. For this reason, you may want to consider setting ground rules for the employer. Set a deadline for the payment and give yourself enough time to send the bill to the work comp insurance carrier to be processed before the 95 days is up. If you receive calls, I receive calls about this in Comp Connection where the healthcare provider is billing the employer and the employer says they're going to pay, but they never end up paying, and the healthcare provider is still waiting for that payment. And in most of these instances, the healthcare provider has waited months for the employer to pay and have now missed their 95-day deadline to send their bill to the workers' comp insurance carrier. So please don't do this, or you could miss your 95-day deadline if you end up changing your election to bill the work comp carrier. So like I said before, setting a deadline for yourself for payment from the employer is going to be very important. Now we'll go over some best practices for billing the employer. If you only have the employer information and they are not helpful in giving you the work comp insurance coverage information and where to send your bill, you can get that from us directly. You do not have to get it from the employer. All you need is the employer's name, the physical address, and the approximate date of injury. Also, if you elect to bill the employer, you cannot balance bill the injured employee for the difference, and the employer does not have to pay the fee guideline amounts. We don't regulate how much they pay you. So this means that if you pay, or the employer pays you 5 cents, you may not bill the injured employee or work comp carrier the difference, and you may not go to the medical fee dispute resolution process with the division to dispute the payment because you waived your rights to medical dispute resolution. Remember to use your interactive resources map to get to the coverage verification page, or go to our DWC healthcare provider page and select the tile that says coverage verification. And I'm going to show you where our healthcare provider page is, just so you're familiar, for those of you who aren't. So here's our website, tdi.texas.gov. You have to click on the workers' compensation tab. And then right below it, you'll see the healthcare providers link. This is our healthcare provider training and resources page. And you'll see the coverage verification here. So you would just click there and then you can do a search. All right, so let's get back to our presentation. Now let's go over medical documentation for non-network claims. You will find medical documentation requirements to submit with your bill in Rule Section 133.210 of the Texas Administrative Code. This rule requires your documentation to be in legible form and also goes over certain medical documentation that must be submitted along with your bill, unless you previously provided it to the insurance carrier or its agents. It's the insurance carrier's obligation to furnish its agents with any documentation necessary for the resolution of a medical bill. The division considers any medical billing information or documentation possessed by one entity to be simultaneously possessed by the other. This rules section requires the healthcare provider to submit medical documentation when you're billing for the two highest evaluations and management codes for new and established patients. These office visit notes and or reports must satisfy the American Medical Association or AMA requirements for use of those CPT codes. An operative report is required when billing for surgical services rendered on the same date when the total of the fees from the medical fee guidelines is more than $500. When billing for return to work rehab programs, you must submit copies of progress notes which support the care, improvement, the date of the next treatment, complications, and expected release dates. When a procedure doesn't have a maximum allowable reimbursement, you'll have to submit supporting documentation, which includes an exact description of the healthcare provided, and an itemized statement is required to be submitted for hospital services. If you're billing for a claim that's in network, the network may reduce the documentation requirements. You'll need to review your network contract or contact the network to verify what is required. Any required documentation already sent to the insurance carrier does not need to be resubmitted, as I mentioned in the previous slide. And this is in accordance with Rule 133.210. Insurance carrier requests for additional documentation. When an insurance carrier requests additional documentation to process a medical bill, the request must be in writing and include a copy of the bill. It should describe information being requested and the specific reason for the request. The documentation must be relevant and necessary to resolve the bill and should be asking for information that's already in or being added to that injured employee's record. Insurance carrier requests for additional documentation can be found in the Rule 133.20H. The healthcare provider has 15 days to respond to a request for documentation from the insurance carrier. You must submit the requested medical documentation related to the charges for the healthcare rendered or respond with a notice that you don't have the requested medical documentation. And just because the insurance carrier has requested additional documentation doesn't mean that their 45-day deadline is extended to pay or deny the medical bill. And I'll be talking about that or about what to do when the insurance carrier hasn't responded to your initial or reconsideration bill submissions a little later in this presentation. We'll now go over the insurance carrier's medical bill processing, and this can be found in Chapter 133, Subchapter C, Medical Bill Processing by an or audit by an insurance carrier. Processing an incomplete medical bill. When the insurance carrier receives an incomplete bill, it must add the missing information already known except for the information listed here, or should return the bill and must do this by the 30th day after the date the carrier received the incomplete bill. So for example, when the healthcare provider doesn't know the work comp carrier claim number, the insurance carrier should not return the bill because this is information that they should have, and also because it's not required if unknown, and the healthcare provider can leave that field blank. Another example is when the healthcare provider doesn't include a social security number on the bill. The social security number is only required when the injured employee has one. If the injured employee doesn't have a social security number, the field can be left blank. And that's again in section 133.10 of the Texas Administrative Code. Actually 133.10 subsection G. Note that the 95-day deadline to submit a complete medical bill is not extended when the insurance carrier returns an incomplete bill. Processing a bill with no employer's first report of injury. When the insurance carrier receives a complete medical bill for a claim in which the employer's first report of injury is not on file with the insurance carrier should not be returning the bill as incomplete. As long as any other written communication, such as a healthcare provider's medical bill, which contains the name of the injured employee, it identifies the employer, has the approximate date of injury, and information that asserts the injury is work-related, the insurance carrier shall immediately create a written record on paper or in an electronic format of the earliest notice of injury. If the insurance carrier is notified of an injury for which it hasn't received an employer's first report of injury from the employer, the insurance carrier shall contact the employer regarding this injury within 7 days of being notified. If they do not return the bill, or I'm sorry, if they do return the bill, you may contact the insurance carrier and reference rule section 124.1, subsection A, 3, D, and F. And that employer should be following these sections. So if not, you may file a complaint if you feel that the insurance carrier is in violation of the rule or statute. I would encourage you to include the specific Texas Administrative Code rule, labor code sections when talking to the insurance carrier or when you're responding to a bill denial or return bill, because the insurance carrier will know that you've done your research and that you are familiar with the work comp rules and statutes. And then this may also help the insurance carrier know that they denied your bill inappropriately and will often pay your bills. So again, I encourage all of you healthcare providers to become very familiar with the Texas Administrative Code chapters 133 and 134, as it will increase the chances of your bills being processed correctly by the work comp carrier. Processing a complete medical bill. The insurance carrier has 45 days from receipt of a complete medical bill to pay, reduce, or deny the bill, or to determine if they're going to audit the bill. Final action means they provided you with an EOB. A medical bill audit. When the insurance carrier decides to audit a medical bill, they must notify the healthcare provider, and they have to pay 85% of the reimbursement and must make a decision regarding compensability, extent of injury, relatedness, and medical necessity. They must complete the audit and pay, reduce, or deny the bill not later than 160 days after receipt of the complete medical bill. Communication between a healthcare provider and insurance carrier. This could be in a letter communication, phone and or EOBs, both from the insurance carrier and healthcare provider. The communication must have enough detail to identify and resolve an issue or question about the bill. Generic statements without an explanation, such as these two examples on this slide, are not enough. So insurance carriers joining us today, please be sure that your EOBs have enough details so that the healthcare provider knows exactly what they must do to correct their billing error. And you healthcare providers, be sure to give details, especially when requesting reconsideration, and explain how the insurance carrier improperly reduced that bill and include supporting documentation so the insurance carrier can correct their billing processing errors as well. Now we'll move on to requesting reconsideration of your bill that was denied or that was paid, but the healthcare provider is unsatisfied with the payment made by the insurance carrier. You can find these guidelines in the Texas Administrative Code, Chapter 133, Subchapter C, Medical Bill Processing and Audit by an Insurance Carrier. A healthcare provider must submit a reconsideration request not later than 10 months from the date of service. Please do not submit a reconsideration until the carrier has taken final action on a bill, which means the insurance carrier has processed your bill and has issued an EOB. Or if it's been more than 50 days from submitting the bill and you still have not received an EOB, if you haven't received an EOB, you can make contact with the insurance carrier to request the EOB be sent to you, and make sure you document how you requested the EOBs. And if requested by phone, document the name of the person you spoke with and their contact information and time of the call. Because remember, the burden of proof is always on the requester, and this information will be helpful to include with your position statement when submitting a reconsideration request, and if you end up having to file a medical fee dispute resolution request or complaint with the network or with the division. And sometimes you can go to the insurance carrier's web portal to pull the EOB from there, which is convenient but not always available with all the insurance carriers. If you have the adjuster's email, you can request it that way as well. And this way you'll have documentation to support you requested the EOB when submitting your reconsideration request, and if you have to pursue one of the administrative remedies with the division or the network. Your request for reconsideration must reference the original bill, so this means that you must have the same billing codes, dates of service, and dollar amounts. It must include a copy of the original EOB or documentation to support that you requested the EOBs, just as I stated in the previous slide. And it must also include supporting documentation that was not sent with the initial submission of the bill. And it has to include a bill-specific position statement. This is where you want to provide as much information as to what you've done to try to obtain the EOBs, like I talked about in the previous slide, and why the bill should be paid. And you'll want to include rules and statutes as well. So for example, if your bill was underpaid, you can explain in your position statement how you calculated the amount to be reimbursed and include supporting documentation that shows the reimbursement amount and include that with your reconsideration so that the insurance carrier knows how you came up with the billed amount, and this will increase your chances of the bill getting paid correctly. And for you designated doctors and MMI impairment rating certified doctors and our office staff that have joined us today, you can include a screen print of the exam fees table that can be found by going to the work comp topics A to Z and selecting C for certifying doctor exam fees or D for DD exam fees. And you will see the exam fees table with the exam fees for 2025 and previous years. And I just received a call about this today, as a matter of fact, this morning. Or the healthcare provider or the designated doctor didn't even know that the fees increased annually. So they increase every year. They have changed for 2025. So if you haven't been on that table, you want to go there and check out those new fees. And I've been told by the healthcare providers that Call Comp Connection that this is very helpful when having to request reconsideration. So please print it as needed to include with your bill. And some healthcare providers even say they include it with the initial submission of the bill and reconsiderations. They'll do anything just to get that bill paid correctly the first time. And let me show you where to find that real quick. So you'll go to our website, workers' compensation. You scroll down here, click on use workers' compensation A to Z, and you can also use your map to do that. But you're going to go to the C for certifying doctor exam fees. Click on that, and you'll see the new rates on this last column for 2025. The date is here. So, and then, like I said, you can also select the letter D and go to designated doctor exam fees, and it takes you to the same table, same information, all the fees for the current year and previous years. I just wanted you to know where to find that. The insurance carrier must return an incomplete reconsideration request no later than 7 days, or respond to the request with an EOB within 30 days of receiving your request. This should be the second EOB you receive from the insurance carrier. For oral requests for reconsideration, the healthcare provider must clearly identify the service denied based on adverse determination with explanation. And no later than the 5th working day, the insurance carrier must send the requesting party a letter acknowledging the date of the oral request as well as a list of documents they want submitted. Then what? Well, whether you got an EOB or not, a healthcare provider must not resubmit it or must not resubmit another request for reconsideration if it's earlier than 35 days from the date the insurance carrier received your first request for reconsideration. If you're still dissatisfied, you may file medical dispute resolution. If you have questions about which DWC administrative remedy to pursue, because there are several, you can call us at Comp Connection, and you'll have to have your EOBs with you because we'll need to know the exact denial reasons, and we can assist you with determining which one is right for you and for your situation. And note that if the medical bill involves a certified work comp network fee dispute, you will follow the network's complaint process and not the dispute resolution process at the division. You'll have to contact the network to ask where to file your formal complaint. And you may choose to file dispute resolution, and your EOB denial will determine which dispute path to take. I would like to emphasize that the Division of Workers' Compensation is not an insurance company, and we do not process medical bills. So please do not send your bills to this address on this slide. Don't throw away your money and this hour-long workout, because remember, the Division of Workers' Compensation is not one of the exceptions that are listed in the Texas Labor Code 408.0272 that we talked about in one of the previous slides. You must submit your bills to the work comp insurance carrier or a willing employer. You can go to our coverage verification page by using your PDF map. Go to DWC topics A to Z and select C, coverage verification, to find information on who the carrier is that is handling the injured employee's claim, or you can send an email to coverage.verification@tdi.texas.gov, and you must include the employer name, employer's address, and date of injury. Also, please do not call the division or the Comp Connection line when checking status of a medical bill. We usually see this from hospitals and their ancillary providers. And just want y'all to know that our agency is a regulatory agency and does not process medical bills, nor can we provide status of your bills. All of your medical bills should be sent to the work comp insurance carrier or sometimes the employer, and that is who you should be calling for the status of those bills. And I know I keep saying it, but it's not to reprimand you, but to help you so that you can get paid for the services that you provided. So in my presentation today, we got to know the billing rules and some of the statutes I talked about. I talked about completing a medical bill and the CMS 1500 instructions, how to submit a bill, and what documentation is required for non-network claims, that is, with your medical bill. What the insurance carrier does with the bill once they receive it. We went over requests for reconsideration, and I showed you where to find other resources. This concludes our healthcare provider billing procedures presentation, and now we want to flex your knowledge. So I'll be putting up 5 polling questions to see how well I did at presenting the healthcare provider billing procedures to you and what you were able to learn today. Question number 1, a medical bill that contains all required and conditional fields is considered a complete medical bill. This answer is true, and I'm glad to see 95% of you answered correctly. And you can make sure that your bill is complete by comparing your bill to the requirements found in 133.10, subsection F1, A through EE. Question number 2. A healthcare provider may choose to bill the injured employee for all or part of the healthcare provided for the work-related injury. This answer is false. A healthcare provider may not bill the injured employee for services or treatment that were provided for work-related injury. And again, this is per Texas Labor Code section 413.042. This is an administrative violation, and if you do this, you could end up as a violator on the DWC list of disciplinary orders. So you don't want to do this. And I see 87%. Great. Majority selected the correct answer. Question number 3. Any workers' compensation medical bill must be submitted within 95 days from the date of service, with few exceptions. And this answer is true. Per Rule 133.20 and Labor Code 408.027. Remember, if you make changes to your bill other than the modifiers or number of units, you still only have 95 days from the date of service to get your bill into the correct work comp carrier. Or if you're billing the employer and you decide to change your election, and now you want to bill the work comp carrier because the employer hasn't paid you, that bill must be submitted within 95 days to the work comp insurance carrier. And the few exceptions to this requirement can be found in Texas Labor Code 408.0272, as we talked about earlier in the presentation. And let's see, number 4. If no employer's first report of injury has been filed, a medical bill can serve as the first report of injury to the insurance carrier. This answer is also true per Rule 124.1. So once the bill is received by the insurance carrier, they must contact the employer regarding the injury within 7 days of notification if they didn't receive the employer's first report of injury. And so you'll want to contact the insurance carrier and reference rule sections that say that that say that they must do so. And it's 124.1. And you may also file a complaint if they don't create a record of a claim or return the bill. And when you file the complaint, make sure, to include the violation or the rule section. So majority answered correctly. Thank you. Number 5, an insurance carrier must pay, reduce, or deny a complete medical bill within 45 days from receipt. This answer is also true, and yay, 83% are answered correctly. So per Rule 133.240, the insurance carrier must process a complete medical bill within 45 days from when they receive it. And like always, if you still have questions about what we talked about today or other topics, or you have a specific issue that you'd like to discuss, please contact us at Comp Connection at 800-252-7031, option number 3. And you may also send your questions via email to Comp Connection at tdi.texas.gov. Thank you so much for joining us today.